So guys, today I'll tell you the middle ear boundaries. Imagine this is my external auditory canal. Now I'm visualizing through my external auditory canal. I'm visualizing my external auditory meatus, and then I'm seeing the middle ear cavity. This middle ear cavity having a 6 wall. Above you have a roof, below you have a floor, anteriorly anterior wall, posterior wall, lateral wall, and also the medial wall. Now I am going to open the lateral wall for you, right? Immediately opening the lateral wall, what you are seeing is the medial wall. Here anterior wall, and here it is in a posterior wall. You have a roof over there and floor, right? Now we are concentrating on our lateral wall. Lateral wall having a tympanic membrane, malleus and incus. In between the malleus and incus you have a chorda tympani. Now in a real endoscopic picture, which we will discuss later in next video, you will actually seeing the IS joint over here in your medial wall, which will be discussed later. But for understanding sake, but for a pictorial 2D representation, here it is your malleus incus, in between running a chorda tympani and a tympanic membrane too. Now concentrating on the medial wall of middle ear. Okay, this is your medial wall of middle ear, and this having a promontory, and you have a tympanic plexus too. And immediately just below the promontory you have a round window, and above you have a oval window. And there are two structures which is coded in blue. The first one is processus cochleariformis, which is a very thick bone. Actually, while doing a cholesteatoma surgery, this is a surgical pointer because this is the last one to get eroded while doing a cholesteatoma surgery. And then you are seeing a facial nerve, and here it is a lateral semicircular canal, and here it is your pyramid. The stapedialis muscle will come and attached with the stapes. So the facial nerve runs below the lateral semicircular canal and above the pyramid or above the stapes. Okay, so this is about the medial wall of middle ear cavity. Here you are seeing the anterior wall. Anterior wall is having a two opening, right? The first opening is for tensor tympani. The second opening is for eustachian tube. So the tensor tympani muscle comes through this and takes a turn in a process cochleariformis and get attached to the ossicle. And here it is a posterior wall. Posterior wall is having a two main structure. The posterior wall is nothing but your mastoid. While doing a cortical mastodectomy, this is your posterior wall. So you are drilling over here. It is your, imagine it is a McEwen triangle. You are drilling over here and you are entering into antrum, and antrum will lead you back to the additus region, attic and additus region. So this is your posterior wall. Additus lies, and here will be your attic. Attic will lies the malleus and incus. Okay. And another important structure which goes in posterior wall is your vertical part of facial nerve. So this is your horizontal part of facial nerve. This is your horizontal part of facial nerve, which comes and turns into a vertical part of facial nerve in a posterior wall, right? So this is your roof. Your roof is having a tegmen tympani. It's a very thick bone, and above lies a dura. And below you have a very thin bone which compresses the jugular bulb. So this is your middle ear cavity of 6 walls. Lateral wall entering into a medial wall, anterior wall, posterior wall, and floor and the roof. Right? Thank you.